Is radiofrequency microneedling really worth it? And what are the risks nobody talks about? Hi, my name is Dr. Namita Murthy. I am a double board certified facial plastic surgeon practicing near Annapolis, Maryland. If you've been researching skin treatments, you've probably come across radiofrequency microneedling. It's one of the most popular, minimally invasive cosmetic procedures, and for good reason. But like any facial treatment, radiofrequency microneedling has real pros and real cons. So today, I want to walk you through those 5 pros, as well as the major cons of this procedure, based on what the clinical evidence actually shows. This way, you can make a more informed decision on whether or not this procedure is something you want to try. Let's start with what radiofrequency microneedling actually is. It's a procedure that combines 2 technologies. Tiny needles create controlled micro injuries in the skin. At the same time, radiofrequency energy is delivered through those needles into the deeper layers of the skin, called the dermis. That combination does something powerful. It triggers your body's natural healing response, which stimulates collagen production. Over time, this remodels the skin's texture and tone from the inside out. Let's talk about the 5 pros of this procedure. One major advantage of radiofrequency microneedling is versatility. Radiofrequency microneedling has been studied for a wide range of skin concerns. This procedure can improve fine lines and wrinkles, acne scars, skin laxity, stretch marks, and even conditions like rosacea and melasma. A large systematic review published in 2026 looked at 41 studies and found consistent improvements across multiple skin conditions with high patient satisfaction. The second pro is that it works on all skin tones. This is a big deal. Many skin treatments carry a higher risk of causing dark spots, especially in people with deeper skin tones. Because radiofrequency energy doesn't target melanin the way lasers do, RF microneedling is considered safer across all Fitzpatrick skin types. Studies specifically looking at skin of color have confirmed a low risk of post-inflammatory hyperpigmentation. Third, the downtime is minimal. Most people experience some redness and mild swelling for a few days, but the majority return to normal activities within 1 to 5 days. Compare that to an ablative laser resurfacing, which can take a week or more of recovery. For people with busy schedules, that shorter recovery window is a real advantage. Fourth, the results are progressive and long-lasting. This is something I find really interesting from a clinical standpoint. The collagen remodeling that radiofrequency microneedling triggers doesn't just happen overnight. It continues to build for months after treatment. Research shows that improvements can keep developing for up to 6 months after the last session. The study even demonstrated that molecular changes in the skin, including activation of protective metabolic pathways, were more pronounced at 6 months than at 1 month. Fifth, it can be safely combined with other treatments, whether it's topical growth factors, platelet-rich plasma, or other energy-based devices. Radiofrequency microneedling plays well with other modalities. That flexibility allows for customized treatment plans. Now, let's talk about the 5 cons, because no treatment is perfect. One downside of RF microneedling is discomfort. Even with numbing cream, most patients have some degree of pain during and after the procedure. The clinical studies show that pain scores during treatment typically range from moderate to significant, and some soreness can last for several hours after the treatment. It's manageable, but it's not painless. Second, multiple sessions are usually needed for RF microneedling. Most treatment protocols call for 3 to 4 sessions spaced several weeks apart. That means a commitment to both time and money. It is important to remember that results with RF microneedling build gradually. Having patience is important because most people will not see dramatic skin changes after just 1 treatment. Third, even though it's not common, there are real potential complications to RF microneedling. Again, complications are rare, but still possible. An analysis of adverse events that were reported to the FDA found that the most common complications included textural changes in the skin, pigmentary alterations, and fat loss, particularly in areas like the face and neck. Burns and prolonged inflammatory reactions were also reported. These events are not common, but they can happen if RF microneedling is done by inexperienced people who don't have the correct degrees or training to do the procedure, as the settings need to be adjusted for each patient. Fourth is that RF microneedling is not covered by health insurance, since it's considered a cosmetic procedure. A full series of treatments can range from $1,500 to $3,000, depending on the doctor's location, the type of machine being used, and the size of the area that is being treated. And fifth, when it comes to RF microneedling, there's still a lack of standardized protocols. Different devices use different settings, needle depths, and energy levels, and treatment intervals. That means your results can vary significantly depending on the specific device used and the experience of the person performing the procedure. The research community has noted that inconsistent reporting of technical parameters makes it harder to compare outcomes across studies. This is again another reason why you should go to a board-certified doctor who has experience in performing this procedure. In general, radiofrequency microneedling is a well-studied, safe treatment with real clinical benefits for skin rejuvenation, scarring, and skin tightening. It works across skin types and has a favorable recovery profile, but it is not risk-free, so you should make sure it's being done by an experienced professional. RF microneedling also requires multiple sessions, and outcomes depend heavily on the skill of the doctor and the device being used. If you're considering this treatment, the most important thing you can do is have a thorough consultation with a qualified, experienced doctor who can evaluate your skin and discuss realistic expectations and tailor the treatment to your individual needs. Drop your questions in the comments below so I know what topics you want me to cover in a future video. Hope you found this helpful. Remember to hit like and subscribe. Thanks for watching.